In this PowerPoint, we're going to take a closer look at the concept of acculturation and its relationship to addiction issues. This term is relevant to treatment and recovery services for several reasons. First, experience of stress or conflict in the acculturation process has been noted to influence substance use and addiction patterns. In addition, understanding the multiple aspects to acculturation for us as providers can increase the positive and quality treatment experiences we can offer for clients. For example, we are better able to assess the cultural experiences, needs, and resources of clients, have a better sense of the specific support needs of our clients, and have another avenue for assessing our own cultural awareness. When talking about acculturation, it's important to acknowledge the history related to this concept, as acculturation is a newer term. For decades, the term assimilation was generally used to describe the process a person, family, or community went through when adjusting to a new culture. However, there were several weaknesses with this assumption. First, assimilation assumed that there was a complete shift from one culture to another, as if it were somewhat of a one-way street. Second, there was an assumption that everyone wanted to and could transition to a new culture in this manner. There was little recognition that there actually may be a variety of feelings, preferences, and possible paths in this process, as well as a wide range of responses from feeling very welcomed or accepted versus feeling mistreated or unaccepted by the new culture. Taking into account that there were weaknesses with the assimilation term, a newer term, acculturation, was developed. Acculturation still explores the process of adjusting to another culture, but approaches it from a more detailed view. Acculturation is viewed not just as a cultural transition, but looks at both the degree of connection to and use of cultural practices. We'll talk more about this definition, but first I want to emphasize that while acculturation still looks at the process that happens when one transitions to another culture, the term itself is one that can be used very broadly. By that I mean we can use it to discuss a transition from one country to another. We can use it to talk about the acculturation process that often occurs when moving from a rural to an urban area or vice versa. And likewise, many in recovery have talked about the acculturation process that occurs when moving from the culture of addiction or use to a culture of recovery. These are just some examples of how acculturation can be used. Returning to the definition of acculturation, we need to take into account two factors. First, the sense of connection one has to the cultural practices and norms. This occurs on both an emotional and behavioral level in terms of how attached someone feels to certain cultural practices. For example, someone may feel very attached and prefer to speak one language over another. Second, we need to take into account the level of use of cultural practices in everyday life. When considering this, it's important to recognize whether someone has the ability to and opportunity to do so. Using the previous example, one may feel a strong connection to a language, but not have the ability or opportunity to actually use it in, for example, a work setting. One of the attempts with the use of the term acculturation was to recognize the variety of ways acculturation could actually occur. This became known as recognizing the possible paths of acculturation. Four main paths became associated with the process of acculturation. The first path explores a shift to the new culture. This path shows there's a preference from shifting to and adopting to the practices of the new culture. This path shows the most similarity to the past term of assimilation. A second path looks at the ability to incorporate and use elements of both cultures. There is really an embracing of some aspects of the new culture while also still embracing and using practices of the culture of origin. The third path focuses on a preference to maintain one's own cultural practices. There is a strong emphasis on maintaining and retaining one's own cultural norms and then resisting the influence of the new culture. And the fourth path looks at ways to take elements of both cultures and transform them in a way that creates a new culture or a subculture. In some sense, it's the transformation with the use of both elements to create a new culture. So, differentiating between a variety of ways or paths for the acculturation process allows for a deeper understanding of the various ways and approaches one may take to the cultural transition process. It's also important to note that a person, family, or community might use one or more paths throughout the actual acculturation process as well as throughout the lifespan. For example, someone may initially focus more on incorporating aspects of the new culture, but then later choose to focus on solely maintaining practices from their culture of origin. Thus, it means that acculturation can take many forms throughout one's life. One additional factor to consider when looking at acculturation is the area of culture shock and acculturative stress. Culture shock is the initial experience of the new culture and the cultural change, and this can result in a range of feelings. Generally, there's a type of an emotional shock, and then that can produce a range of feelings, some of which may be exciting or very fearful. In addition, there exists the concept of reverse or re-entry culture shock, which addresses the experience of returning to one's own culture after being away for an extended period of time. Related to culture shock is the concept of acculturative stress. This generally refers to the stressors and the various stress responses one may have during the actual acculturation process. For example, issues of anxiety, depression, substance use, and addiction can occur due to the changes and the different stressors that can surface. Both of these concepts can also have a strong impact on the recovery process. So, for us as providers, it can be helpful to be mindful and aware of these terms when providing treatment services.